I'm going to give you some of the context first of all, and then move on to talk about the federal, provincial, territorial framework for action. Now, I'm doing this in the context that I was the co-chair of the Population Health Promotion Expert Group, which was part of the Pan-Canadian Public Health Network. Two things happened. The network was reorganized and that group no longer exists. Jean was a member of that group at the time, and it's now been reorganized into a Healthy People and Healthy Communities group. And also I've moved from working for the Ministry of Health to working as a professor in the new School of Public Health here at UVic. So I am a bit out of the loop in terms of anything that's happened since about May or June of this year, other than what's publicly available, but I will cover off what was done to then, because in that capacity I also was one of the four sort of co-leads that developed the original framework for action to promote healthy weights, which was approved by the Minister's Bank about a year ago now. Now, interestingly enough, and just a bit of context for that, we were originally asked to develop an action plan about 2 years ago, I guess, and when we started to develop a fairly detailed and comprehensive action plan, the response was, whoa, we didn't really mean that. Just give us a framework for action. We were too far ahead of where they wanted to be. So we scaled it back into a framework for action, and then there has been a process that's still ongoing to actually turn that into an action plan. So we do not at this point have an action plan, we have a framework for action. Before I get into that, I want to spend a moment or so, I'm going to gallop you through another context piece which I want to touch on because I think it has not had the attention it needs, and I think it's potentially very useful, not just for obesity, but for a range of other issues. So if I go to the next slide, that context is a declaration on prevention and promotion which was approved at the same time as the action framework by the ministers about a year ago. And I point to this because if you're not aware of it, you should be, because it has a number of powerful statements that we, I think, can use to advocate for our position of improved funding for public health, improved resources, improved attention, improved priority. So next, all of this text is taken from the declaration, and you can find it online through the Public Health Agency's website or through the Pan-Canadian Public Health Network's website. So there's a statement that this is a priority and a linkage of this to the sustainability of the health system. Next slide. It built on the integrated Pan-Canadian Healthy Living Strategy, which was approved back in 2005, and which importantly identified two goals, and these goals were thus, in effect, restated in this declaration. And the first is to improve overall health, and the second is to reduce health disparities. The ministers and the deputies still like this word, health disparities. I don't like it. Inequities is the word we should be using, but nonetheless it gives us the goal we need to be able to say, yes, reducing inequalities in health is something that we are committed to or should be committed to, and we should demonstrate that commitment. Next slide. So that we identified, or they identified in the declaration that they approved, 5 principles to strengthen and support prevention, and they are next. First is that prevention is a priority. So simply saying that, yes, prevention is a priority, and that promoting health just makes good sense, and that we need a better balance. Second slide, forward again. That prevention is a hallmark of a quality health system. I think it's really important to understand that nationally and internationally, prevention and health promotion are recognized as essential pieces of a high-quality health system. Next, thirdly, the linkage of prevention to management, particularly for chronic disease prevention. If you look at a lot of chronic disease prevention, it includes many of the things that we know are also, sorry, not chronic disease prevention, chronic disease management. It includes many of the things we know are also important for prevention. So if you have a chronic disease, you should be doing a bunch of things that are also useful for preventing both progress in your own disease, or the disease you have, and the development of additional chronic diseases. So linking prevention to management. Fourth, that there are a range of factors that need to be, or approaches that need to be used in health promotion, and the ministers, don't forget, are committing themselves to all of this stuff. So this provides you with ammunition, if you like, to turn back to your minister and say, well, you know, you all approve this statement, this declaration, in fact, and we want you to actually deliver on it. So it includes very deliberately within this set of approaches here, addressing stuff outside the health sector, population health promotion initiatives, and public health services, clinical prevention services, healthy living, which to my mind is a form of self-care, and doing and using research. So again, useful ammunition. Next slide. And in an ideal situation, all of these strategies should be used together. So it also includes statements about effectiveness, cost effectiveness, and tailoring an approach to the community or group involved. Next. Finally, it makes the point about population health promotion requiring the involvement of sectors both outside health but within government and also beyond government. And so we need to get everybody involved. So I flagged all of these points for you just to make the point that there is a very useful declaration, and it provides, in fact, a context for how we can then approach childhood obesity. So moving on to the next, which is I'm going to take some time discussing, and again, this Curbing Childhood Obesity framework, you can find it on the Public Health Network of Canada's website and the Public Health Agency's website, and I hope most, if not all of you, will have seen it already. So let me just highlight some of its central points. Next, one of the important ones to understand is that this is a complex system, and that there's a complex and interacting system of factors. And what I, in retrospect, should have included as the next slide here, but did not, is the UK obesity map. I don't know how many of you will have seen that, but it's a very complex map. I actually wanted to include it in the framework, and it was considered too complex for deputies and ministers to get their heads around and too scary, so it wasn't included. But I think that what worries me a lot about our approach to obesity is a simplistic approach that says, well, just get people to be physically active and quit and eat less and we've solved our problems, and then points the finger at individuals and say, you're responsible. So the point here is that this is a complex and interacting system of factors. It's a system of factors. And so there's a number of different sectors that influence childhood obesity. The focus here, of course, is on childhood obesity. And this operates at all levels, from the individual to the family to society as a whole. So let's rule out simplistic responses. It calls for a sustained multi-sectoral response, including public, private, health professional, and non-governmental sectors. And this is all language, again, straight out of the framework document. Next. So the vision links this issue to the notion of healthy weight. So we don't just want to focus on obesity and be finger-pointing and labeling and stigmatizing, but what we really want to do is create conditions for healthy weight so that children can have the healthiest possible lives. Next. So there's a whole variety, as Jean has mentioned, of strategies that can influence overweight and obesity in childhood, everything from the availability and affordability of nutritious food, and parenthetically I would say that what I didn't see in Jean's slides, and I'm curious about, physical activity shows very high, but I'm not sure if there was a measurement or whether it was included, about the amount of food people consume. Because I think it's not just about what sort of food, but simply the overall gross amount that's being consumed. Gross being sometimes the appropriate word. So this list of strategies, I'm not going to go through it, but it does start with early in life. So we took a sort of life course approach to this. So it's nutrition in pregnancy, baby-friendly health settings, and that of course includes supporting breastfeeding, the marketing of foods and beverages, and so on. And then ending with the need for positive mental health, because there are issues and relationships there too. Next. So in the framework, which is, remember, not the action plan for childhood obesity in Canada, it is the framework for action. Three broad strategies. One was to make this a collective priority for action for SPT ministers, and the adoption of this framework in part does that. It means coordinating efforts on three key policy priorities, and I'll talk about each of them very briefly: supportive environments, early action, and nutritious foods. And it means measuring and reporting on collective progress. Next. The first was to make it a collective priority, and the idea that the ministers would champion the issue and encourage shared leadership and complementary action. That, I think, is an ongoing challenge, but there has been some of that through the dialogue process, which I'll come to in a minute. Next. So this calls for, and I think this is important again to recognize this is the language of the ministers in the document that they approved. A collective effort is required to create environments that make the healthy choice the easy choice. Now, that doesn't just apply to childhood obesity, of course. It applies to every health problem we face. So again, I think here's a useful phrase that we can kind of use to urge them to take action, not just on obesity, but in other areas, and then promoting opportunities for individuals, families, and communities to take action. So again, it's not about just the individual or the family. Next. So in the area of supportive environments, how do we create physical and social environments where children live, learn, and play more supported? And we have to do this in the family, at school, in the community, throughout the various developmental phases of childhood. So again, a broad environmental approach to creating supportive environments for healthy weight and, for that matter, for healthy child development in general. Next. Strategy 2.2, identifying the risk and addressing it early. This is interesting because it's not just a matter of prevention of obesity. We also have to deal with the issue of managing overweight and obesity in childhood. There's a lot of kids out there, as Jean's just shown, who already are overweight or obese. We can't just focus on preventing others joining them. We also have to figure out how we deal with that problem, because otherwise they will remain obese into adulthood with all the problems that entails. So this means regular monitoring, it means a range of developmentally appropriate interventions, it means support for children who are particularly at risk of obesity, and so on. But it also means we have to have programs that help overweight and obese children to lose weight, and that has to be part of the strategy. Next. Thirdly, within this broad set of sort of policy and supportive environment approaches, looking at ways to increase the availability and accessibility of nutritious foods, particularly in northern, rural, and remote communities, and particularly around this issue of the marketing. And what are we going to do to regulate and control the marketing of foods and beverages that are basically unhealthy? Next. And then the third overall strategy is to measure and report on collective progress. How are we doing? We need research and surveillance to inform policy options. We need to track, and we need regular monitoring and reporting on progress. Next. So, what the ministers approved a year ago was this framework for action, but not the actions themselves. And they said the next step would be to engage youth and multi-sectoral leaders across the country. So, what's happening with respect to that? They launched what was called a national dialogue on healthy weight back in March, with this purpose in mind, with a website, opportunities for online and in-person dialogue, and a national summit. What's happened since then? Let me just summarize that. Next, there was an online component which closed on July 29th. So what's that, about 4.5 months after it was launched. I don't know, because I've been out of the loop since at least July 1st, if not a little earlier, how this really went. But I must say, when I went on the website and looked at this, it only got 75 likes on Facebook, which doesn't sound to me like a very large impact. The top 3 ideas that came from this online dialogue was to shift the focus away from weight, develop a national cycling strategy, and ban all advertising like we did for cigarettes. But again, if you look at the number of votes these top 3 ideas got, it doesn't give you the sense that there was a huge amount of engagement through this strategy. Next, there were then a set of roundtable discussions that the ministers committed themselves to, and because I've not been in the loop since then, I can't tell you what's happened with respect to those, but I assume that I know 1 or 2 had started or were planned before I left the ministry, but I don't know where this went. Next. And there was a national summit was slated for fall, for now basically, in Alberta. That has been postponed until the spring. My assumption is that it's postponed largely because of the large number of elections that are underway, and and so there's a lot of uncertainty with respect to ministers and their ability to be there or to engage. We've had, 5 provincial elections in the last month, so this is postponed until the spring. So that's where things sit right now, and it could be that there are people online who can add to this, but right now that's all I can tell you. So let's be nice and say it's a work in progress.